The partnership between Rwanda Biomedical Center and BGI, I think, is very transformative. So this collaboration allows to bring new technology by BGI to really also support Rwanda Biomedical Center and Rwanda to rapidly scale up the use of DNA testing to detect human papillomaviruses, which I think is which I know is one of the major risk factors and cause for cervical cancer. Second, this partnership is also aligned with our strategy to reach the WHO target before even 2030. For us, we have strategies to eliminate cervical cancer and reach the WHO target by 2027. So it's really a timely partnership as we working together to make a screening for cervical cancer very cost-effective by applying new technology for DNA, but also applying new, a simple way of sample collections using the self-test kit, which I think is going to reach many women in our communities. Cervical cancer is one of the leading cause of cancer death in our women. It's also a condition which can be prevented if it can be identified as soon as possible. As of today, the donation of 20,000 test kits for DNA, HPV DNA testing, for me really is good support as we continue to deal with this major cancer. Also, if you want to see this partnership, it's really a partnership which is based on the shared visions and also aligned with Rwandan good leadership and also our ways of integrating new technology, not only for the specific HPV testing, but also other infectious diseases, using the same technology, same platform to address many problems. In my talk, I describe the role of pathogen genomics in responding to outbreak in my setting. I'm really convinced that there is many impacts that pathogen genomics has played in protecting the life of our community by understanding, having the formations of the genome from the pathogens. It's really very helpful for a public health institution to really understand the pathogen and also discover new pathogens as we understand the makeup of the pathogen, to be able to really monitor. It could be viruses, bacteria, parasites and others, and also contain to stop the progression of disease or epidemic before it can reach the wide population. This pathogenic genomics is going to really continue to make huge impact in our day-to-day life. And with the new technology coming on board today, we hope that we'll have even more impact as we continue to build our capacity to have genomics information to understand pathogens as we respond to new infections and also new emerging diseases and pathogens. My visit to BGI was very informative. It allows me to really meet the BGI team, to really understand from where they came from and today where they are, but also what they are planning for the future, and also the opportunity to discuss with colleagues at BGI teams to really see if there are new areas of collaborations, leveraging on what we are now collaborating on, to see if there are any sustainable or long-term partnership with BGI. So I see BGI as a great partner for us for continuing to build our capacity in genome sequencing, but also using the information from genome sequencing to really provide some solutions in our efforts to deal with diseases like non-communicable diseases, where we can also bring those areas of genomics like omics and proteomics.